Come in.
Hi, Miss Lisa.
Hi.
My name is Delilah. Stinson. I am a nursing student at the University of South Alabama in Mobile. And today I will be doing a head and neck assessment. Do you give your consent?
Yes.
Miss Marianne, will you please scan the room for me?
Yes.
Miss Lisa, I'll be starting with your head. Your head, your eyes, your nose, your mouth, and your ears all appear to be even and symmetrical. I'm going to look at your scalp, as well, and then palpate it for tenderness and look for any kind of sores or anything like that could possibly be in your hair. Your hair is brown with gray strands. There's no signs of dandruff. Scalp very clean. Miss Lisa appears to have very good hygiene. Any tenderness?
No.
Okay. The first cranial nerve that I will be assessing today is the trigeminal nerve. I am going to use the soft part of this eraser to assess your sensory. Okay. Say okay when you feel it.
Okay.
Okay. Now I will be assessing your the motor portion. Can you clench your jaws for me? Okay. So that was cranial nerve number 5. The trigeminal nerve and your sensory and your motor nerve is intact. Okay. So next I will move to your facial nerve, which is cranial nerve number 7. Can you smile for me and make faces? Okay. So that's your the motor. It is intact. Your sensory would be blow out your cheeks. Resistance. I'm trying to pull down. Raise your eyebrows for me. Okay. So your facial nerve is intact. Okay. Next, I will be moving to your eyes. Your eyes, your eyelashes, your eyebrows, all those things are even, they are present, and they are symmetrical. Your bulbar conjunctiva, which overlies the sclera, is white. Your polar conjunctiva that lines the upper and the lower, that lines the eyelids of the top and the lower part is white. There's no pinkness. There's no pink. The sclera is white with no signs of jaundice. Ptosis, you have no signs, no facial drooping or anything like that. So what we'll do now is that we will go through some of the vision screenings to test your eyes. Okay. So your eyes. Sorry for flashing a light in your eyes. Your pupils are round, and they are about 4 millimeters in diameter. And this is a test that you call PERLAC. You'll test the accommodation, the convergence, the direct consensual part of your consensual light. So basically, I will shine this in your eyes, and they do constrict. This is your left eye constricts on the right, and the right constricts on the left. So they are reactive to light. For direct and consensual accommodation would be I have you to look off at that smoke detector, and then your pupils dilate, and then I bring you something close within your vision, and they constrict. Okay. So the next test, that will be accommodation, and so your next test would be convergence. Can I get you to look here? Okay. So the convergence, our eyes did move smoothly on the axis while testing the convergence. Okay. So your next test would be, if I had a snelling eye chart, It will be on the wall, and you will stand 20 feet away, and then you will read the line toward the end, the one that you can see clearly, and you would close one eye and then read off the lowest line, or the one that you could visibly see, and then the other line, the other eye as well. It will be bilaterally, and then your results, we'll read off the number and tell you what your results will be. But since I don't have that today, I'm gonna give you the handheld vision screen for you to read off. For you to actually read off the line closest that you can see, and can you cover one of your eyes for me, please?
LFT PH.
Okay. Oh, that's 20/20. Can you do your other eye for me? Okay, can you see?
LTFPH.
Okay, good. So you have perfect vision, which means you have 20/20 vision, okay? So the next test that I will be doing, it will be the extraocular test. And I will be using 6 chromal gaze. Please follow my hand. Okay. 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 So that the cranial nerves that go along with that test is cranial nerve 3, oculomotor, cranial nerve 4, which is trochlear, and cranial nerve 6, which will be abducens. And all cranial nerves are intact. And also the coronary light reflex, once I cut the light, turn the light on and shine it into your eyes, I'm supposed to see the glare of the light in both eyes. Okay? And the light is shining equally in both of your eyes. So the next test would actually be, we're gonna assess your ears, okay? So I have the helix, the anti-helix, I have the tragus and the antitragus, and the lobule and the external meatus inside of the eye, inside of the ear. And I would do those bilaterally. I did not see any drainage or anything coming from your ear, no redness, do you feel any tenderness? Okay, no tenderness going along with your ear. So now I will do the whisper test. Can you please cover one of your ears? It doesn't matter which one, and repeat after me. Whisper. Other ear. Cats. Okay. So if you were not able to hear those sounds, then we'll refer you for further testing. And so now we're going to assess your nose. Your nose is actually midline, and I'm going to look inside of your nares. The nasal mucosa, it is pink. There are no deviations or anything with your nose. We're also gonna check patency. Can you put one hand over your nose and blow? Sniff. Okay. Right, opposite. Sniff. So that checked the patency. So in order to assess your sense of smell, I would have offered you two aromas for you to be able to smell, to let me know if you're able to smell, or tell me the difference between the two. And if you're able to do that, then that means your olfactory nerve, which is cranial nerve number 1, would be considered intact. Okay? So I'm gonna calculate your nose. Do you feel any kind of tenderness or pain?
No.
Okay. So moving right along to your mouth, your lips, they look pink. There are no cracks in them, no forms of cyanosis. Okay. All teeth are intact. The inside of her mucosa, it is pink. Her mucous membranes is pink. Her tongue is pink. There are no lesions or anything or sores inside of her mouth. Her hard palate is pink. Posterior is white. And her uvula is in the midline of her mouth in the back. Her tonsils are present, and they will be considered +1. Okay, so now you can come. You need to come. Okay. Are you okay?
Yes,
You need some
thank
water or
you.
anything like that? No, you're good. Okay, so now I will be moving towards her, the lymph nodes, going down to her neck, okay? So first we're gonna have the preocular, which is in front of the ear, the postocular in the back, the occipital in the back of the head, the mandibular, the submental. Then I will have the superficial, clavicular, clavicle, cervical lymph nodes, post, which will be in the back of cervical lymph nodes, and then I will go down to the deep part of the lymph nodes. Oh, and then the tonsils. Forgot about those. Okay, and then the posterior lymph nodes. I think I did those. And then so next, I would need to do the ones that are considered deep. Can you shrug your shoulders just a little bit, and then so palpate those. All of the lymph nodes were non-palpable and they were not tender. And next, I will assess the cranial nerve number 11, the spinal accessory nerve. Can you shrug your shoulders for me? Try to meet resistance. Okay, turn your head to the left. Try to work against me. Okay, to the right. Okay, cranial nerve number 11, the spinal accessory nerve, is considered intact. And that will be considered the end of my assessment. Thank you, Ms. Lisa, for your help. I really appreciate you.
Thank you.